Essential Dental Systems presents Access Post, the passive post system with more advantages than any other passive post. Access Post characteristics. The patented thick-walled, hollow-tube design of the Access Post system provides the strength of a solid shank post. Vents hydrostatic pressure of cementation for easier post placement and a more secure cement interface. Offers the ability to remove the post should there be a failed root canal without surgically widening the canal. Guides retreatment drills for safe post removal and access to the apex. The undercuts of the head and shank provide excellent retention and resist rotation of the core material. Locks in post cement to provide high retention of the shank. The multiple tiers prevent high apical stress under function common to other passive posts. Adapt to the anatomical flare of the canal for optimum dentin to metal contact and maximum stability. The positive seating head stabilizes the restoration by resting on tooth structure and safely dissipates the stress of occlusion. The highly retentive head offers additional surface area for core material adaptation, resulting in stronger retention. Access Post clinical case. An access post is placed over an accurate X-ray of the tooth. The coronal end of the second tier is positioned at the cement enamel junction of the tooth. There should always be at least 1 millimeter of dentin remaining lateral to the apical end of the root. If there is less than 1 millimeter remaining, then either a smaller diameter post should be used or the current post should be shortened until 1 millimeter of the tooth structure is regained lateral to the apical end of the post. Once the appropriate size post has been selected, the matching EDS Gates-Glidden drill or piezo reamer is used to remove the gutta percha from the canal. For matching size selection of drills and posts, see the illustration chart in the instruction booklet. A rubber stop is used to maintain the proper depth of the post hole preparation. All EDS Gates-Glidden drills are color-coded to match both reamer and post sizes. The full depth of the post hole is created by inserting the primary reamer into the canal until the shoulder contacts the coronal dentin. It is best to limit the number of entries into the canal to once or twice. Following the primary reamer, the secondary drill is now used. Once again, the drill is inserted into the canal until the shoulder contacts coronal dentin and prevents further entrance of the drill. Always cut wet. The secondary drill creates the preparation for the second tier of the post. This tier increases the retention and stability of the post in the root. The post is now placed into the canal to ensure proper fit. We want to make sure that the second tier is fully seated and we have enough occlusal clearance. If the post is too long for the post hole and the second tier of the post is not fully seated into the second tier preparation, the post must be shortened. The post is adjusted by grinding the apical end until the second tier fully seats into the preparation. The appropriate grooving drill is selected for the size post that was used. The yellow drill for the yellow post and the red, blue, green drill for the red, blue, or green size posts. The grooving drill is inserted into the canal and then pushed against the canal wall and rotated in a circumferential manner. The drill will create retention grooves in the canal wall for the cement. This will greatly increase the overall retention of the post. The canal is now washed with water and air dried to remove any dentinal debris. FlexiFlow cement is now mixed and placed into the canal with a Lentulo spiral. The Lentulo will deliver the cement to the bottom of the post hole. FlexiFlow cement gives the dentist approximately 3.5 minutes of working time to place the post. The access post is coated with cement and placed into the canal. Here we can see the post rising up out of the canal due to the viscosity and hydrostatic pressure of the cement. Pushing the post down again into the canal directs the cement up and into the hollow portion of the post. This relieves the hydrostatic pressure and assures full seating of the access post. Next, the excess cement is suctioned away before it sets. The old bridge, which was used as a temporary, is now trial seated in the mouth. Here we can see that it does not fully seat onto the teeth. We have placed marking spray in the crown and reseated the bridge. When the bridge is removed, the high spots and areas of impingement on the post are colored green. The green spots on the post are relieved and the bridge is tried in again for fit. A bonding agent will be used before the core material is added. This will assure bonding of the core material directly to the post and the remaining dentin and seal the core to the root. Here we are acid etching and washing the area. The bonding agent is mixed according to the manufacturer's directions and applied to the dentin and the post.
Ti-Core, or Ti-Core Natural, a titanium and lanthanide metal reinforced core material, is syringed around the post and placed into the crown of the tooth. Here we see the bridge being seated and the excess Ti-Core Natural expressed around the margins. The excess Ti-Core Natural is easily removed with an explorer before the material has set.
The bridge is taken off and the excess core material in the sulcus is carefully removed. Excess core material on the core can now be ground off. The access post and core restoration is now complete. It can be incorporated immediately in the final treatment for the patient. The access post is the only post that allows you to retreat recurring apical infection. The post is hollow to act as a guide for retreatment drills, allowing you to easily remove the post without perforation or widening of the canal. If you know the size of the post in the canal, follow the graph enclosed in the retreatment instructions, which tells you the sequence of drills to use for removal of the post. If you do not know the size of the post, assume you have the thinnest post placed and are therefore going to use the thinnest retreatment drill.
Remove the core material above and surrounding the post. Expose the occlusal surfaces, as well as the lateral surface of the post, down to the coronal surface of the root. This can be done with either a diamond burr, a long shank high-speed fissure burr, or a number 2 or a number 4 round burr.
Before placing the drill, make sure the hollow in the post is open by placing a sharp explorer tip into it. Once the hollow occlusal opening of the post is exposed, place the first retreatment drill for that size post in the slow-speed handpiece. Place a rubber stop on the shaft of the drill at a distance from the tip of the drill equal to the total length of the post. Slowly let the drill enter the opening of the post. Advance the drill until the rubber stop on the drill lines up with the remaining occlusal portion of the post. In this case, we have the full length of the post in the root. If not, adjust the rubber stop on the drill for the proper length. To minimize the possibility of the drill catching in the post, drill in small and down motions, and advance the drill in small increments. The objective of retreatment is to remove the old access post entirely. Note that sometimes during drilling, the second or third drill will bind within the post. If there is enough torque, the cement seal will break and the post will loosen, allowing it to be removed. Also, during the course of drilling, the post may loosen but not come out. In this case, disengage the drill from the handpiece and rotate the post by hand. This will remove the cement from the post undercuts, and you then can remove the post with a hemostat. Note, the access post removal has not damaged or enlarged the post hole. You are now free to proceed with endodontic retreatment. FlexiPost, the patented split shank post, is ideal where adequate coronal dentin exists. Maximum retention with minimal insertional stress. FlexiFlange offers the patented split shank FlexiPost while incorporating a flange to provide stability in situations where there is inadequate coronal dentin and excessive occlusal forces, anterior and posterior. Flexi Overdenture a patented split shank post with a ball and socket attachment that delivers the highest retention for full and partial dentures. Access post. Based on a unique thick-walled, hollow tube design, the patented access post system is a parallel-sided, triple-tiered passive post. ExactaCast, a patented triple-tiered burnout post system that offers an easy, standardized way to achieve the reliable, predictable cast post. AccuSet, a dual-cured acrylic resin for creating and repairing temporary crowns, inlays, and onlays. FlexiFlow, a patented reinforced fluoridated composite cement with strength similar to Denton for superior retention. Available in gray color or FlexiFlow Natural in shade Vita A3. Ti-Core, a patented reinforced fluoridated core material. Cuts like Denton, no grooving or ditching. Available in gray color or Ti-Core Natural in shade Vita A3. Essential Gates Glidden Drills, conveniently color-coded to match all Essential Dental Systems primary reamers. Glove & Care, a specially formulated hypoallergenic hand cream for the care and relief of dry, irritated hands caused by wearing latex gloves.